This is RegisteredNurseRN.com, and in this video we're going to discuss geriatric nursing. Geriatric nurses have the special job of caring for elderly patients. Their focus is to develop and implement treatment plans for patients with chronic and acute illnesses, which may include respiratory conditions or diabetes. They also provide their services to the families of these elderly patients by providing counseling and educating them about the nature of the illnesses. Geriatric nurses provide care for patients who suffer from diminishing mental conditions as well, who are no longer able to make decisions on their own regarding their health. Additionally, these nurses provide treatment in the home of some of their patients on a regular basis, although these patients do have the ability to care for themselves on their own in many cases. And some of the responsibilities of a geriatric nurse includes creating care plans for patients and establishing health goals, providing patients with assistance during procedures and examinations, educating family members on the conditions of patients, administering medications according to the patient's care plan, and conducting tests on patients in their homes or at medical facilities. The requirements to become a geriatric nurse is, first of all, you will need to go to a nursing school, and most accredited nursing schools will offer the program, which is either a 2-year or 4-year degree. A 2-year degree is the associate's degree in nursing, and a bachelor's degree is the 4-year degree. In most cases, a bachelor's degree is better if you're looking to possibly go back to graduate school, or if you want to stand above the competition a little bit, or maybe advance in your career up to managerial positions. An associate's degree is fine, though, in most cases. Once you get your degree, you can sit for the NCLEX State Boards test, and you will become a licensed registered nurse, and you can specialize in geriatric nursing from there. And generally, they like you to have about 500 hours of supervised clinical experience to receive certification in this area, and sometimes up to 2,000 hours of geriatric nursing practice or 2 years experience to move up to more sophisticated positions. And there is a certification, which is the American Nurses Credentialing Center, that you can earn in geriatric nursing. Okay, now what about the salary? Well, the salary for nurses are very good, and for a geriatric nurse, it's about $70,000 or so annually. Advanced degrees can earn you even a higher salary than that, and that's going to vary depending on your education, your experience, and so forth. If you're an entry-level nurse in a small town, you may earn substantially less than that. You may earn as low as, say, $30,000. But the median annual salary for this type of nursing is about $70,000. As far as the outlook, it has a wonderful outlook. It's predicted that 20% of the population in the next 20 years will consist of those aged 65 years and older. Since elderly adults primarily make up the majority of ambulatory care visits, hospital stays, and home care visits, geriatric nursing does hold a wonderful opportunity for nurses right now entering the field. So if you're interested in becoming a geriatric nurse, or if you want to know more about the area of nursing, please stop by our website. We have free care plan examples, salary information, a whole list of different nursing specialties, and we want to help you develop yourself as a nurse, advance your career, and so forth. So it's RegisteredNurseRN.com. Make sure to stop by, and thank you so much for watching, and have a great day.